Do you want to do introductions, or should we do introductions so long? Then as people come in, we'll go from there. So I am Dr. Jakavula. I am a psychiatrist based in Cape Town, South Africa, Western Cape. I am a mental health advocate, and I'm joined by Dr. Jakavula due to unforeseen circumstances, having to join us from an unexpected location. He is a medical doctor, psychiatry trainee, and also a mental health advocate. So because today is World Mental Health Day, we wanted to add our voices to the conversation about mental health, both in our communities and worldwide. So hopefully you guys will be able to benefit from our conversation, share it with your friends, ask people to join, and so on. Okay. Dr. Jakavula, welcome to you. Thank you for
Thank
agreeing
you
to.
for having me.
Sure. So I suppose we could start with just basically, what do we mean when we say mental health? What does that mean for you?
I'm having a problem on my side because your record is replaying.
Okay.
I don't know what's going on.
So I'm asking mental health. What do we mean when we talk about mental health? When we say mental health?
Okay. So mental health has a very broad definition, but when we try to simplify it, it's about a person who's having the ability to um to 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 to, to who has control of their higher facilities, as they say, who has the competence to make decisions for themselves, to make choices, on a daily basis, who is able to think, and critically apply thinking, um, and also who is able to have what we might say acceptable or normal emotion responses to his or her own environment and things that are happening in their immediate environment. So it's not merely, as they usually say, it's not merely absence of disease or illness, but it's also being able to do all of these things. Um, of course, we do have days where we are off, where you'll feel down and you'll feel a bit offish under the weather. But if you are overall having all of these functions and able to do them independently, that's what we mean by mental health, and you are able to find ways to cope with the daily stressors, because everyone comes across stressful situations, anxiety-provoking situations. So if you have means and ways of coping with those things, then we say that you have fairly impaired mental health.
So basically, functioning well within your environment, as you said, not just absence of illness, but being able to actually function meaningfully in your day-to-day life. I like that
And with
explanation.
and with people around you, yes.
Yes. Okay. So then, as we've said, today is World Mental Health Day, which is part of a greater mental health awareness month. The whole of October is Mental Health Awareness Month. Why do you think it's important for us to have things like this, things like Mental Health Awareness Month, World Mental Health Day? Why is that important?
Okay. So one of the major things that we want to do as health practitioners, and particularly mental health practitioners, is to raise awareness about mental health and about mental illnesses. Now, there is a general problem that we face in the field of mental health, which is called stigma. So people who suffer or who live with mental illnesses are stigmatized and are treated in a particular negative sort of way by community, labeled certain terms. So firstly, we want to destigmatize mental health by raising awareness and also to equip the community, to equip people living with mental illness, to equip people supporting people living with mental illness with knowledge and skills of how to better support each other, and what things they need to do in order to be able to live meaningful lives. Because the fact that you have a mental illness doesn't mean that you can't still live a meaningful life. And that's part of what the stigma does. It crushes you, it crushes your spirit to to feel that you are subhuman. So this is part of the reason why we need these campaigns and we need to raise this awareness. And also in part, we live in a society where we, especially our country, which is South Africa, we have what is called curative medicine and what is called preventative medicine. Preventative medicine is where we apply programs and awareness campaigns to prevent illness. So part of the reason why we do these campaigns is to educate people on things that they can avoid, that they should avoid to develop certain types, because there are preventable types of mental illnesses which are caused by things that we do as individuals. So we want also to raise awareness to prevent the onset of those types of illnesses. Where there are illnesses, that we want people to be equipped to understand what those illnesses are about and how to live with them.
I think especially you've made some good points, and especially when it comes to stigma, I think an important thing for me as a Black person is that mental health and mental health condition, mental health treatment, all of those things is still poorly understood within our communities. So things like this continue to provide us the opportunity to, explain to people and demystify some of the problems that our fellow Black people are facing, especially within this African continent. We have a lot of, not to put aside anybody's traditions or spiritual beliefs or anything, but to also add to the understanding of what might be going on for some individuals. And I think that's where the importance of these days come in as well. As you said, it raises awareness. It helps to prevent possibly developing certain conditions, but also helps to reduce stigma. And I think also the other thing that you've mentioned that I really like is not just for the people that are dealing with it, but also we consider those that are that have a family member or a friend that is dealing with an issue. I think those are the people that we often forget about, We think about the person that's suffering, but not necessarily the person that is helping the patient, as it were.
I don't know if I'm cutting you.
Sure.
I wanted to add something.
Okay, Raggy, I think maybe we do you want to do questions now, Dr. Jakavula, or should we bank them for later so as to allow the flow?
You can. It's up to you.
Let's see. So Raggy has said, how do you feel about organizations inquiring about history of mental illness for jobs and such? I am personally quite concerned about the implications considering the levels of stigma that exist. Raggy, that's a very, very well. Let me allow Jakavula. I think maybe you might have even more of an insight on this question.
You think we're going to do it now?
Sure. I think
Okay.
it might be we can do it now.
I think the issue of asking about of asking about mental illness in history for jobs would be job specific. I think there are cases where it is justifiable. Um, ethically, morally, you might say, you might argue otherwise, but there are cases where it's justifiable, just like the case of epilepsy, because there are jobs where one having a risk of having fits or seizures would place the person and a lot of other people in danger. Therefore, you need to know the person doesn't have that risk. I think to answer that in a more personal way, would you would would you like to have a pilot who is severely depressed, who is having thoughts of killing themselves, flying your plane for you for 15 hours? Because I think that's the most common job where I know that definitely mental illness is critically important, and they actually do extensive testing and psychologically to make sure that you are safe. So if it's relevant to the task at hand, then definitely personally and professionally I would support it, because we have to mitigate risk as well. We have to balance between the privacy of the individual and also the public as well. So in that instance, but generally, if it's not relevant to the job, then one can argue either way. So I'm sort of on the fence on that one.
And I think the big issue is again that stigma. If it's not relevant to the job, for example, and they can guarantee that even if you disclose that you perhaps have an anxiety disorder, depression, or psychosis, or whatever, that they're not going to treat you differently, or that they might actually be more understanding of you because of the fact that you might be prone to having episodes of relapsing and active symptoms, then um, one could justify asking it across the board. It would be the same as if you were disclosing that you had a cardiac condition or diabetes or things like that. So I think that's the tricky thing with mental health conditions, is because we want it to be seen on the same plane as everything else, but we do understand that at the same time there's a lot of barriers to it actually being, so much as we say yes, it's just an illness like diabetes, or it's just an illness like heart attack or whatever, hypertension. The truth is it's going to take us a while to get there. It's going to be a little bit of a give and take. Those that are having the illness, I think, will have to display trust in others to handle their diagnosis well. And then those that are asking for the diagnosis to be exposed should also then appreciate that trust that people have put in them, and then not discriminate against people with mental health conditions and things like that. But yeah, thanks for the question.
And there's something that I just want to add to that, which a lot of us, even as professionals, as health professionals, we miss sometimes. I remember just reading something in one of these books that we read, that we need to be careful in terms of pathologizing things that are normal, like making something that's normal to seem like it's not normal. Because you must remember that even people with mental illnesses, people living with mental illnesses, also have personality. They have personal characters or characteristics which might not be related to the mental illness. Um, but now sometimes, as we talk about stigma, because that is the big thing, as you mentioned, Dr. Jakavula. Sometimes people act in their natural personal character, but now because they've got this label as well of having a mental illness, then immediately they start shouting or acting in a particular way. Um, which might have been accepted if they didn't have this label. Then they get, they say, there she goes again, or there he goes again. And then maybe they start calling security and all of that. So it does become tricky at times because obviously we're not going to be talking about patients with sin, but I've had an incident where one of the patients I was treating, in their professional capacity, they work in a senior position, and so they do have this personality that they have, but now every time they act according to their personality, we're gonna get complaints as the treating doctor because they've got this label that they've got this condition. So it's a very tricky situation. I don't think there's a right or wrong answer personally, but I think you just look at the context of the situation.
But I think it again emphasizes why it's important for us to continue to have these discussions, have these talks, because it helps bring awareness to these various issues, But yeah, so in terms of risk factors, what would you say are, like, what should people keep an eye out for in terms of risk factors for developing mental health conditions or?
Okay. So it starts from I'm gonna try and be a medical person now. It starts from pregnancy, firstly. So
Way back.
the mother is pregnant and carrying a life inside of her. Some of the choices and decisions that she makes during her pregnancy, whether she's drinking alcohol or abusing substances, will have an impact on the brain of the life that is developing inside of her. So if a child is exposed to substances inside the womb, that's definitely a risk factor that when they come out of that womb, they might have they might grow up with a mental problem or mental illness rather. Secondly, use of substances even as an adult. We know that it's a huge thing that's happening in the country, throughout the country, where people are using speak and all of these other things, like whether they use them recreationally or not. But one must remember that the effect that one joint of dacha has on you might not be the same as on the next person. So you might cope with one joint. I might go, crazy and start hallucinating and seeing things. So the use of substances because of peer pressure and all of that is part of also risk factors. Being in situations where you are abusing alcohol, which is also a substance, will also put you at risk of having injuries, particularly head injuries, or also because long-term use of alcohol can cause a diseased brain, which might not manifest now in your younger, part of life, but later on in life, you might then experience problems. There's a question that you posed, ID, during the week about what we think affects our mental health more. I can't remember the other points. There were 4 things, but the environment.
Yes.
The environment. I remember the environment because I said that for me the environment is a big thing. The environment that one plays a big role in mental health, and even as I was driving here now, I was thinking about that because it's something that we often ignore. It's something we put at the back of our minds, but it really has a big impact, whether it's at work, whether it's at school, at home. It has a very big impact on your mental health. And if you're in a stressful environment that's constantly triggering you or anxiety provoking, you might develop mental health problems. Yeah, there's quite a lot. Those are just some of the things that I can think of at the top of my head.
I think
Um,
those are good ones in general. Others could be, I think it's in terms of mitigating risk is about taking good care of oneself. I think one forgets the effect that your physical health has on your mental health. So if you are able to engage, I mean, yourself in good healthcare practices, to an extent, one might be able to reduce the risk of developing certain kind of conditions. And then I think with regards to the post that you're talking about, we spoke about emotions, which I want to talk about this coming week, physical health, psychological, and environmental. Psychological, one cannot underestimate the ability to deal with issues properly, you know? I think a lot of us may not come from backgrounds where you were taught how to properly handle your emotions, how to properly deal with stresses. Some of us have the background where you have to keep a straight face because, especially as blacks, again, we have this, we pay a lot of attention to what other people will say. What will the neighbors say? What will the extended family say? So a lot of us have this history of having to keep a straight face, you know. So when you come from backgrounds where you are taught proper coping skills, proper handling of stress skills, and things like that, taught or even just making it not so much a taboo to have emotions or to see a psychologist if necessary, I think that helps to also mitigate the risk. And also a good social structure, a good support social structure. I think the one thing that has been happening right now is the COVID. COVID has thrown a lot of people into mental health crises because of that isolation, not having people that they could readily turn to. So, and you don't necessarily need a lot of friends, but even if you have one or two good people that you can talk to or that you can go on a walk with or something like that, that really helps to take away some of the stress and reduce some of the pressure. Yeah, I think, as you said, it's there's quite a lot of things that one could talk about.
I, I,
But I think,
I
yeah.
I wanted to
Mm.
add just something in terms of what you're saying about mitigating the risk. There's something we are really, I don't want to say we're ignorant about, but we don't pay particular attention to, and it's affecting a lot of teenagers. It's affecting a lot of young adults. Social media. What you're
Yes.
talking about, what people are gonna say. You know, we have a phrase for it in my language, which is bazothina bantu. What are people going to say literally? So we call it bazothina bantu syndrome. People live. We've got this Instagram, we've got this Facebook, which people create an illusion of a certain lifestyle that now people like me must then chase. I don't know for what reason, but I must chase now and compete with someone that I don't know who's living a certain lifestyle on social media. But also the kind of news that we are exposed to, the posts that we're exposed to on social media. I'm gonna say this also personally because I've had periods where I've needed to take a break from social media and just switch off for a couple of weeks because the news that you get are so, you know, it's always negative. Everything is negative. There's nothing positive you're really getting out. So that also has an impact on your mental health. So it is important to know yourself and how, as part of the environment, how social media is impacting on your mental health as well.
Yes, I think that's extremely important, and especially because we are living in a new age. I think the effects of social media, especially, will still be seen in the coming years because of the fact that it's a relatively new phenomenon. But you're right in terms of that one feels this pressure on you to compete with what you are seeing, and it's on every level: financial, relationships, and not just romantic, but you see families and you're like, oh my gosh, why can't my family be like that? Pets, you enter a subtle subconscious competition with another person. And I think, as you've said, it's important to sometimes be able to take a step back, take a break from all of that and refocus yourself, so that that effect is limited on you. But I'm interested to see what the long-term results of the social media age will be on mental health, and especially us in being in the mental health field. I can imagine that it will become quite an important factor in the patients that we treat going forward. And then perhaps just lastly, as what are some of the more common mental health issues that people might face, and what are just general management principles? So most commonly, I know for me, we see a lot of substance-induced problems, and people can be a little bit unsympathetic towards people that use substances, but we then realize that it's a combination again of all those factors: your environment, the hopelessness, the lack of support structure, the lack of skills to deal with stress, and all of those things that can contribute to the substance use. What then that can lead to psychosis, that can lead to violence, that can lead to depression, that can lead to cognitive problems, so memory problems and things like that. I think that is one of the biggest things that we see. And unfortunately, the sad thing about that is that it's young ones that are falling prey to that. And we also live in a culture at the moment where it's quite cool to use something like cannabis or Turk or so on. And as you said, there's no way to know if you are going to be the person that has a bad reaction, because you see also the pop stars, the famous people using it. So why not use it? And unfortunately, you find yourself landing in the hospital. So, and for people like that, I suppose management would be rehab, social support structure, admissions, and so.
It's interesting you mentioned this because in most black-dominated areas, which is township, the cocaine and heroin, because they are relatively expensive types of substances, were not as common. We didn't see as much use of them. We saw use of teak and all these makeshift substances, wunga,
Yeah.
nyaupe. But
And
now
alcohol.
we are starting to see increasing numbers of cocaine use in townships. We are seeing increasing numbers of heroin use and these other expensive types of substances. Um, what you see is, I had a conversation with someone recently. We were talking about the community initiative that we wanted to do. Um, we He was exactly what you're saying, contextualizing substance use. That it's easy for us to be unsympathetic or lack empathy for people or young people who use substances, but we don't question the root cause of why it's becoming predominant. The rates are becoming higher and higher in the society. Because he was saying that we, like specifically in my township, there's now a group of people who go out and patrol and look for criminals, like these petty thieves, the young boys who do petty crimes, who steal just to support their substance use. So, but he was saying that it's important for us to look at why are these boys doing this. It's not just them wanting to use the substances, but it's because part of the reason is the socio-economic reason that there are lack of jobs. We're not justifying their use of substances. We're not justifying their criminal behavior, but we are saying that these are contributing factors to them doing these things, and we need to deal with this holistically. So you mentioned rehab and these other things that we can do, support structures that we can use to treat these people, these young people and even older people for that matter. But if we're gonna take them back to the same environment without changing what led them to use the substance in the first place, that becomes then the big issue, the big issue. And also, just to add to some of the other common conditions that you're talking about, which, as we are trying to raise awareness to our communities, that it's also important to highlight that sometimes you have an overlap of conditions. Some people might have one condition, some people might have a constellation of conditions that they are living with. Some people might have physical illnesses like epilepsy, which can manifest in a way of mental health symptoms. So there's a variety of common illnesses which can be in isolation or which can overlap. Depression often is accompanied by anxiety, which we've spoken about. And I find that there are a lot of people who actually suffer from anxiety who don't realize that they suffer from anxiety. Especially people with chronic disorder. Um, you'll find that they've been having these things for months, for years with panic attacks. But when you actually take the time to speak to the person, they've never been given a proper diagnosis. They've never been educated about this condition and what might trigger it and how they can or what they need to try and manage it. Um, then there's also another thing that I wanted to mention and highlight before I forget. We have these people in our community who suffer from what we call psychotic disorders, including schizophrenia, which is well known, or psychotic disorders due to other issues, where people create their own reality, or the brain creates its own reality to simplify it. But people don't know that these people can also suffer from depression. And it actually took me a couple of years to learn, that people can have depression within that spectrum of illness. But we often dismiss it, say, this one is crazy, this one is, part of the stigma that we're talking about. And also, the last part is related to the elderly, and I've been dealing with this a lot over the past few weeks, where we are neglecting, especially in the black population, we are neglecting our grandmothers, our mothers, who are in their 70s, 80s, going upwards. And when they start to behave in a certain way that we find is foreign to their normal behavior or is deviant from their normal behavior, we forget to think about depression, that they might be depressed. Because in our minds, these are our heroes, these are people we grew up looking up to. So they cannot possibly be depressed. So it's very, very important that we understand that the elderly are very susceptible to becoming depressed. So that is part of thing. If you are supposed to look after the elderly or have as an elderly relative, it's one of the things that you need to keep in mind when they start, to feel concerning.
Okay. And when it comes to basic principles of management, what should people keep in mind?
Basically,
Doctors or homeopathy,
so
self-help?
so 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 the issue, we spoke about beliefs and alternative medicines. So the issue is always the family obviously is in control. We give the family autonomy. We give the family autonomy on how to decide, how to approach management. We make recommendations, but at the end of the day, it's the family that will decide, or the patient if he or she has the capacity. But the basic principles of management are always to access mental health services, which is one point I wanted to raise initially, but I forgot early on in our discussion that is one of the biggest challenges we have. We have Cape Town or Western Cape, we have Gauteng, we have KZN, which relative to other provinces have fairly, good access to mental health services, even at your primary health level, even at your rural areas. But then we have provinces like Eastern Cape, provinces like Limpopo, provinces like Northern Cape, where they might be very, very limited access in those areas, which is why the conversations that we are starting now and that we would want to continue become important, because people need to know that if I can't access help here, what alternatives do I then have? But the first port of call is always the clinic. But
Local.
you find the reality is that in some areas you find that even the health professionals working in those clinics are not uh, really trained well in the management of mental health illnesses. So it becomes a bit of a challenge, but it's always your first port of call, and then hopefully, they can then refer you along the pathway. But you must also remember that as community members, that there are community-based organizations in a lot of areas, even the provinces I've mentioned. There are community-based organizations which are non-profit, um, which are non-governmental organizations that assist and support people with mental health users. There are schools because there are kids who are called slow learners who have intellectual development problems. There are schools where they are taught vocational skills so that if they can grasp that, they can at least be able to do something to sustain their lives, as they grow older.
Mm.
Because obviously some of them are not on treatment, but they need some form of support to survive. So, and also us as the you spoke about a structure, social structure. Us as the family, us as the friends of the person living with a mental illness, we form a very critical part of the management. Because if that person feels isolated, as you mentioned now with COVID, people, their pillars of strength, of support fell apart as well. So everyone was looking for support, but there's no support. We so social structure does form a huge part of support. Um, yeah, and educating the person, obviously what we're trying to do to educate the person and the people around them, to equip them with knowledge about what to do, when to do it, how to recognize when you're in trouble, when you are relapsing, educating the person about their medication, because some people stop taking their medication because they don't know why the hell they are on medication. They don't know what it's for, and they feel great, especially people with bipolar mood disorder, where they feel good, no medication for them. So it's
Yeah.
important to always take the time to educate our patients, our clients, and also the people supporting them about the importance of compliance with medication and what to do when they run into problems like having side effects and all of that.
Okay. Um, Thank you. I think the topic of mental health is so wide, and
There is.
it can be broken down into more subtle nuggets that one can continue to have conversations for a while still to come. But for today, yeah, I just wanted us to have this light, light conversation, and that can give us an opening to going into more depth about different things, because there's still a lot more, I'm sure, that we can talk about just in general. But I think at least adding that our voice to the conversation, so that those that were able to pick from today's session, at least we got up to 10 views at some point. So at least those are 10 people that we've been able to educate and share some mental health knowledge about, and carry on disseminating information, hopefully helping them with bettering their understanding. So with regards to mental health. And on that note, any parting words for those that are left? Any final statements? Or
parting words are that please take care of your mental health. Please take care of the mental health of the people around you, and please check up on your loved ones. You know, some people suffer in silence, and sometimes we feel we are intruding on people's privacy when we check on them, and they don't want to be checked on, but whilst they are silently crying for help. So we can prevent mental health into deterioration by just doing basic and simple things, humanly things, ubuntu basically. So that's all I can say for now, and thank you for having me, and I hope that these conversations will continue, and we go further in depth.
Thank you. Thank you so much, Dr. Jakavula, for joining me. Thank you for the discussion. Thank you for those that have stuck around. Any last minute questions from anybody? And then for sure, definitely, I think we will have another session and more topics to discuss. I'll also ask the viewers at another time to suggest topics for us. But I like this idea of Sunday lives, having mental health discussions, having, discussing topics with people. But let's see. Okay, so we don't have more. Okay, let's see. Jessica says, what strategies can those supporting those with mental issues caused by substance abuse use? That is also quite a difficult problem. Well, it's a good question, but a difficult solution, in the sense that a big issue with mental health conditions is that the insight is lacking for the individual that's suffering it. And those that are using substances also struggle with regards to understanding at that moment why using this is wrong. Because most people use substances that makes you feel good. You feel happy, your stress is gone, you're sleeping well, you're energetic. So if you're telling me leave this drug and come and, let's say somebody is unemployed, has no friends, come and sit here and just be sober, it's going to be a hard sell. So I think the first thing is understanding. Those that are around the individuals need to really try and understand the factors that are at play. At the same time, because it is a difficult situation, I think it's reaching out. So a lot of the communities have support agencies. So either you can go to the clinic, where they will link you up with a social worker who can then refer you to, if there are specific drug-related structures in the community, people can start off going there. And then you also have these narcotic anonymous type of organizations that typically it's in the more well-funded cities and things like that. But the one good thing about COVID is that it forced people to provide their services through technological means. so that now, if you did have access to data, at least you could contact some of these or access some of these services via like a Zoom meeting kind of thing. So the support is really, really what is important. And then taking the person to get assistance at the hospitals or at the clinic, which can be difficult. As we said, the insight is lacking, but the government has gazetted law enforcement, so the police, to be able to assist you to take a family member or colleague or associate to the hospital for assessment if things have become so severe. So the drug is causing the person to be very psychotic or very depressed, suicidal, manic, just a risk to themselves. The government allows you to ask the police to, hey, please, can you come and help me take this person to hospital? And then at least they could admit the person. And sometimes that helps with regards to letting them detox for a short while. And then you can hopefully put them on medication with, if there is a condition like a psychosis or depression, and then also avail them to psychologists, again, social workers, and help them be part of the journey to wellness.
Don't know if I can add to that.
Yeah. Okay,
just to add, there is a process that a lot of people are not familiar with. Just that I'm not sure which act it falls under, but that's not relevant anyway. So because usually there's the teenage boys that are problematic, but for anyone who is behaviorally a problem continuously after using substances, what you're mentioning, the behavior, aggressive behavior, and all of that, you can, because rehab, a lot of rehab facilities are on a voluntary basis. They don't accept people if you don't have insight that you assist and you need help. But then, if you can prove that the person becomes a danger to themselves, there is a court process where the person can be compelled with a court order to go to rehab. The only issue with that is that they can't stay indefinitely in a rehab center. So if they still feel that they are not, the substances are not a problem, when they come out, they will probably go back. But you hope that after that program, then they will be. But that program is usually, you usually have to approach your social worker in your area, in your community, and they will assist you to through the legal processes and how to get a court order. The person has to be assessed by a doctor physically to see if they are physically fine, and then they take it from there. Also, we always encourage family members, because there is misinformation that is spread, but I don't want to label our colleague by name, but there is misinformation that is always spread that you can't lay a criminal case against a mental ill person, which is not true. You can open a criminal case against anyone if there is obviously evidence or something like that, if there is a reason for that. It's not for the police to say that they want the person will go to be prosecuted or not. There are processes to be followed. But what we always encourage is that if a person uses substances and breaks laws every few weeks or every month and assaults people at home and does this and that, ensure that you open a criminal case against that person every time. If the police are refusing to do that, you ask for the station commander or senior, whoever is managing that police station. We always encourage that, because it creates a trail that this person has been documented to be causing havoc every time they use substances. This becomes handy later on. Obviously, it's one of the things we will discuss maybe when we have these conversations again in depth, but it becomes handy later on because most hospitals can't keep people indefinitely as mental health users. if a person is fine and sane and able to do to make decisions for themselves and are not at risk, they get discharged. But there are processes where a person may end up incarcerated in a hospital indefinitely under certain conditions legally. So always make sure that if a person commits criminal behavior, you lay a case and you have a case number every time.
Thank you. I'm going to just read these last few comments because I think our time will run out. Jessica said, mental health facilities are so expensive. They are unfortunately private ones. I think that I'm going to jot that down because that's a topic that I'd like to discuss as well in terms of mental health care being accessible to people. That's one of the difficulties that people face, especially in a country where there's a lot of socioeconomic disparity. But I'm going to make a note. I'd like to have a live session and discuss that a bit more. Skorizu said, I never knew not caring about things one's used to are also symptoms of mental disorders. Yes, it can be a part of depression, which can either then be part of depression itself or part of a larger picture, like Dr. Jakavula said, schizophrenia can also be part of things like your cognitive disorders, your dementias and so on, where you actually don't know how to care for what you used to anymore. Then Soulfeed, thank you for such an informative session. Please have more. Thank you so much. I'm wanting to do these every Sunday evening. Also, please feel free to DM me topics that you'd like us to discuss. And also sometimes I'd like to have the viewers join in on the discussion so that it's not just us professionals, as it were, having the discussion. So definitely. Sophie, may I ask what that we speak about mental health risks associated with the irregular use of ARVs? Okay, for sure. I will make a note of that and then I will schedule that for one of our Sunday evenings. Next week, Sunday, we are going to have a psychologist on so that we can speak about the psychological approach to mental health, mental well-being, and so on. So I will make a note of this for sure and then schedule it into one of our sessions. Thank you very much for the suggestion. And thank you once again, Dr. Jakavula, for joining me and for having this conversation on a very important World Mental Health Day, 10th October 2021.
Thank you very much, and thanks to the guys that joined us.
Sure. Thank you for your comments and questions. Thank you for joining, especially yes, on your way. Safe travels further. Sure. Bye. Bye, everybody.